As a psychiatrist, why on earth would you care about hormones and women's health?
Hormones are psychiatry. Estrogen, progesterone, testosterone are all neuroactive steroids. They modulate things like serotonin, dopamine, GABA, glutamate, the very same neurotransmitters that every antidepressant, anxiolytic, and antipsychotic medication targets. So it's really super important for psychiatrists and anyone dealing with the brain to be aware of hormones and the importance of these particular neuroactive steroids that we lump together as sex hormones. And really, when things like estrogen drops, whether it's after childbirth or across the menstrual cycle or perimenopause, you get mood dysregulation, anxiety, cognitive fog, sleep disruption, a lot of the things we'll touch on today. And a lot of women end up seeing either a GP looking at it from a mental health perspective or a psychiatrist and end up with diagnoses like borderline personality disorder, bipolar, treatment-resistant depression. I hate that term, by the way. And really get prescribed medication when what they need is optimizing and better understanding of their hormone health. So it is really crucial that as a psychiatrist, I'm aware and I'm literate about hormones and the impact of sex hormones in particular on brain health and mental health. Start with looking at the dopamine and serotonin systems in women with ADHD or autism. They're already operating differently to a neurotypical woman. So they're already compromised in terms of how their brain chemistry is. Helpfully, estrogen has a direct upregulating effect on dopamine. So it supports dopamine and acts like a natural Ritalin in the brain. It helps enhance focus, working memory, executive functioning. So when it peaks in mid-cycle in a neurotypical woman, there's what we call mild cognitive enhancement. She's operating at a higher level in terms of her brain. In a woman with ADHD, that estrogen peak in her monthly cycle might be the only thing that really is keeping her functional because already at a compromised level. But when estrogen drops premenstrually, postnatally, or perimenopause, the cognitive and emotional crash for a neurodiverse woman can be extraordinary. Women in general with ADHD, for example, find better ways of coping with life than men. But these coping strategies are systematically taken away when the estrogen and hormone levels start playing up around perimenopause and menopause. And all of a sudden, a neurodiverse woman, whether she's been undiagnosed or diagnosed and managing to find coping strategies, can find themselves very exposed, very vulnerable. And I do see a lot of middle-aged women around the perimenopause who are being increasingly diagnosed with ADHD because their natural coping mechanisms have been kind of stripped away due to the hormonal changes.
One thing I really want to tackle that comes up a lot is HRT and cancer fear. I want to sort of get this, tackled head on because the fear around breast cancer has stopped huge numbers of women from even considering treatment. In fact, I think the last statistics that I saw said that only 14% of women in the UK are currently on HRT. But what does the evidence actually say about HRT?
Thanks for bringing this up. I think it's such a crucial topic. And the story of HRT and cancer, I would say, is medicine's most consequential examples of misinterpreted data. So if you look back at 2002, we had the Women's Health Initiative publish results suggesting that HRT dramatically increased breast cancer risk. This led to women stopping treatment overnight, doctors refusing prescriptions, and an entire generation of women really left suffering unnecessarily. Because the devil was really in the detail of that study. The study itself used synthetic hormones, specifically conjugated equine estrogen and synthetic progestin called medroxyprogesterone acetate, not the body-identical hormones used in some modern HRT. In the study, when you separated the estrogen-only arm of that study, so the women who only had estrogen, and this particular study, it was those who had hysterectomies and couldn't take progestins, there was actually a reduction in breast cancer incidence. So really, it was a signal around the synthetic progestins that were used and their direct impact on increasing breast cancer risk. Multiple subsequent meta-analyses, which is the gold standard of research synthesis, have confirmed that body identical progesterone carries a significantly lower breast cancer risk than synthetic progestins. And the absolute risk from HRT, even in studies using combined therapy with estrogens and progesterone, is comparable to that of drinking 2 glasses of wine a day or being overweight. Risks we never tell women to avoid in the same breath. So the conversation has been completely disproportionate to the actual.
Why women who already have a history of trauma, anxiety, depression, or other mental health struggles can find things get worse during perimenopause, or sort of feels like it comes back with a vengeance from nowhere, even if they've been managing it sort of well for years, but nothing obvious has sort of happened to cause it?
Well, if you look at trauma, I think it's like a triple whammy, because not only is women's health poorly understood, trauma is even less understood, and the impact of trauma on biological systems is pretty much ignored. So what we understand is that trauma, whether it's in early childhood, mid-childhood, adolescence, early adulthood, at any point in your life, it does leave a biological fingerprint on the stress response system. So we call that the hypothalamic pituitary adrenal axis, or HPA axis. And women in particular who've experienced significant trauma, it's child abuse, domestic violence, have been operating with a dysregulated HPA system for many years. So the trauma directly impacts our resilience and our ability to manage stress. Sometimes this goes on for decades, but then when they enter into perimenopause, estrogen, which really helps regulate the HPA axis and the stress response, dampens cortisol reactivity, which is a stress hormone. It supports serotonin synthesis. It modulates the amygdala, which is the brain's threat detection center. So when estrogen declines, all these protective buffers are progressively removed. And for a woman with a healthy stress response, this is challenging by itself, but for a woman whose stress system was already dysregulated by trauma, this can be pretty catastrophic. And it might look like quite a significant breakdown with high levels of dissociation, anxiety, emotional dysregulation. And it's really that biological scaffolding that's been torn away by the reduced hormone levels and estrogen in particular. And the tragedy is that a woman with a history of trauma is probably already labelled as someone who's emotionally unstable or difficult. And this further delays the recognition of this having anything to do with hormones.